Welcome to 10-5, the official podcast of the OPP Association. My name is Scott Mills. I'm one of your co-hosts.
And I'm your other co-host, Emily Brown. For those new listeners, the OPP Association represents nearly 10,000 members of the Ontario Provincial Police in Canada. Our members are at the heart of everything that we do and are our greatest strength. And we're dedicated to keeping our members and the public informed about key issues that impact policing across Ontario.
And thanks a lot for that, Emily. We have a very interesting and important discussion about to happen today about testosterone treatment for police personnel and first responders. And just for a little bit of background, we previously recorded an episode here on the 10-5 podcast focused on police women and menopause, and we talked about hormone replacement therapy. And one of our guests today, OPP Provincial Constable Mat Aris of the Corunna Detachment, he wrote into us and suggested a topic of testosterone therapy. And Matt and I have been talking back and forth for quite a while now, but we've found a very knowledgeable member of the medical profession. His name is Pharmacist Mat Rezaei, who is willing to discuss this often not discussed topic. So we've got two Matts here, and I think we're going to refer to one as Police Officer Matt and the other Pharmacist Matt. So welcome, Matt, and welcome, Matt.
Well, thanks for having me.
Thank you so much.
Well, welcome to you both. So this is a super interesting topic, and I don't think it's talked about enough, as Scott alluded to. And I think a good place for us to start is to have you both introduce yourself and explain briefly what brings you both to have an interest in this topic, in testosterone therapy. So as Scott mentioned, we're going to be making a distinction between the two Matts. So we'll start off with Officer Matt. Can you give a brief introduction of yourself, please?
Matt Aris. I've been a provincial constable for 10 years now. Why I'm interested in testosterone therapy? I would say in more of a general health interest that I've always taken to, even at a young age, starting in my teens. It started with sports performance and then just wellness and longevity. And then I'm sure we can get into it, but this job slowly kills you in a way. And one of the things that's dramatically affected, which I believe is related to all it is testosterone and hormones in general. And so I took an interest to it, I don't know, my whole life, basically.
Well, thanks, Matt. I know you and I have had many discussions, and just a bit of a disclaimer here. We're not intending on providing official medical advice on this podcast. We're aiming to have a discussion, and we recommend that if you want more information to discuss with your own doctor and seek the advice for your own situation from your own medical professionals. But with that, I think we're going to turn it over here to our guest, our professional pharmacist, Matt. And can you give us a brief introduction of who you are and why you have an interest in testosterone therapy?
For sure. Thanks for having me on. I'm Mat Rezaei. I'm a registered pharmacist, 15 years and counting of being a pharmacist. And I'm the founder and CEO of OPPGuys.com, which is Canada's online men's health platform. Around 5 years ago, my interests basically went more for men's health. And what we do in OPPGuys.com is we help men talk to the doctors over the phone. And if appropriate, we deliver medications right to their doors. Focus, which is related to our discussion today, is more on conditions that are underdiagnosed and mostly stigmatized. We mainly work on sexual health issues, and also testosterone replacement therapy is a big interest of us for obvious reasons that I'm sure will come up through the discussion here.
Great, thank you for that. I'm going to continue with you, Pharmacist Matt. So I'm not going to get used to that. So we're going to touch on some initial questions that people might have regarding this topic. And I'm just going to shoot a few of them at you, and maybe if you can touch upon a few of them. So maybe what are some of the symptoms of low testosterone? Is it common? Is it important to get tested, and above what age? Maybe some misinformation and some treatment options.
Oh, okay. Wow, that's a big question. So that's a big question. I try my best to answer. A little bit of background is, what is testosterone? Testosterone is a natural hormone in both men and women, although we think of it more generally as primary male sex hormone that basically delivers more of the masculine traits. It does way more than that in our body. As I said, both sexes will have testosterone. They have testosterone. It helps with obviously sexual functions, but more importantly, I would say, regulates our metabolism. Cognitive function is affected by testosterone and levels of testosterone. Cognitive functions are affected by levels of testosterone, muscle function, fat distribution, bone health. Testosterone is a very important, basically, part of our body, again, both sexes. In men, it is mainly produced in testicles, but travels throughout the body to perform basically its different functions. When we talk about low testosterone, low T, we simply mean that your testosterone levels are less than or below of a certain range. And in men, at least, it leads to some symptoms. That was part of your question, Emily. Obvious, or basically the symptoms that we heard a lot about, are lower sex drive, trouble with erections. That's a big one. Low energy and feeling of fatigue. Low motivation and determination. Interestingly, low motivation and determination is one of the most obvious ones for men. They kind of see the before and after that they had, and this is the most important symptom that many of our men discuss, that basically finally convinced them to come to check up at least. But there are other symptoms like decreased muscle mass and muscle strength, increased body fat, and lower bone density and anemia, which is low blood cells, red blood cells. Those are mainly discovered through tests, not necessarily symptoms that patients basically complain about. Overall, as it goes down in your body, testosterone levels, you see basically different malfunctions in your body, as well as a big hurdle in your cognitive ability going forward, basically. You asked, Emily, how common the situation is. It's definitely more common than most people think. I would say it's interesting. Research is not like something that is done in this field in a way that you like, meaning that you look at this field, it is really underappreciated. But I was looking at different research that are measuring different types of testosterone, different ways of measurement, try to gather like a more graspable type of information, came up with this. It's not basically the exact science, but it helps us understand how testosterone works in our body and how it decreases with age. If you are 40 and above, there is a 40% chance, approximately, that you have some level of low testosterone. You might gotten to the point that you see the symptoms already or not, but there is a 40% chance. Another way to say that is 40% of men who are aged 40 and above are dealing with some sort of low T levels. The interesting part is the numbers goes up as you age, meaning that 50% of men above 50 are dealing with the same issues. 60% of men, about 60. I round them up to basically bring this home that as we age as men, eventually, at some point in our life, we are dealing with low T. It's just person to person, there is a difference. My biochemistry is different than yours, and I might see symptoms earlier on. What was the other questions you had, Emily?
Well, if you could continue on and just talk a little bit about misinformation about TRT and then maybe some available treatment options.
Sure. So misinformation, I want to talk about a few of them. As I said, TRT or testosterone in general, a little bit underappreciated in literature, even among physicians and pharmacists, let alone public. One big misinformation is some people confuse testosterone therapy with the steroids that are used by some, say, bodybuilders looking to bulk up. I want to say that testosterone structurally is a steroid, but not the way you think. So first, let's double click a little bit on steroids. Steroids are simply chemical structures found in many important components of all of our bodies. Our hormones are steroids, many of them progesterone, estrogen, testosterone. Cholesterol is a steroid that is making our cell membrane all across our body. So a steroid is not a bad thing. Our body has a lot of steroid right now. The problem starts when synthetic versions of steroids are made. In some cases, they are 40 times, 50 times more potent than natural steroids and are abused by high doses by basically some people, mostly youngers, as enhancer drugs. So when we think of steroids, if we mean those medications that are sold in black markets, used by 20-something years old to bulk up, testosterone is not that. Fundamentally, when we talk about TRT, we are not talking about that concept. We are talking about returning your hormonal levels to normal range. So we are talking about people with symptoms that are tested and proven that their body is not making enough of a hormone named testosterone, and we are just supplementing them enough to adjust and correct that ratio gap, basically. So one big misconception or misinformation, misunderstanding is testosterone is one of those synthetic steroids, and it's not correct. The other big fear or like this big misinformation around testosterone is testosterone therapy with the way that like I try to define it, which happens under constant supervision of the doctor. Some people, or like old-fashioned way of thinking about testosterone was it can cause some issues, namely prostate cancer. That was part of the older research done 30, 40 years ago, and unfortunately still lingering in the medical literature. So prostate cancer originally thought that it is connected to testosterone therapy. Recent studies definitely debunked that, but still it's part of what people associate with testosterone therapy. Have in mind that we monitor in a right way of doing TRT. We have to monitor patients for lab tests every 3 to 6 months. And among all the tests that's done, prostate health is also measured through blood tests. So I can even argue that basically if it's done properly, the risk of prostate cancer is less because it is constantly monitored, at least because of that mentality that lingered for a long time in this field. The other misinformation or lack of knowledge sometimes, which could be a good segue to your other question that you asked about the common or like options, treatment options. Misinformation is many people think that testosterone only comes in injection forms. And not everybody is basically a big fan of injecting themselves. But the alternatives are there now, and in future it would be more and more. One disservice that basically very early on research did to this field was raising some, I would say, not too careful, basically, conceptions in people and medical fields' minds. And many research and development in many cases didn't happen or didn't catch up with the new ways of delivering medication for testosterone. It is changing. Different forms and different options are coming to market. But even right now, there are other solutions than injections, which I can explain more about some treatment options. If you want to talk a little bit about treatment options, I would say basically we are looking at two main approaches of treating low testosterone. One approach is to use medications that boost your body's own testosterone production. There are a number of medications used in this field with the goal that, hey, let's stimulate your own system to produce more testosterone naturally in your body. So that is one approach. Many people talking about pills, they're talking about that approach. There is no effective testosterone pill in Canada right now. I can explain a little bit more in future. But one way then is to let's boost your body's own way of creating testosterone. The second approach that is more common is, okay, let's give testosterone itself to your body to basically increase the existing level of testosterone in your body. Then if we focus more on the second part, which is actually giving testosterone, there are two main form of giving testosterone to one's body. One is injectables. Many people are familiar or heard of injectable testosterone. These are mainly long-acting oil-based injections that can be self-administered. Either they administer that intramuscularly or what we call subcutaneously, which is into belly fat. These are used once or twice weekly. There are other schedules around it, but twice weekly is the most common way. This is injectables. Many people are familiar with injectables. And the second way that is gaining popularity now is topical or transdermal testosterone. Those are the ones that you apply on your skin daily. It comes in a measured device, meaning that the doctor will tell you, hey, apply 3 pumps or 4 pumps. You apply it on an area like shoulder area, rub it in for a minute or so, and they are gone. They are fully absorbed. It was not that popular maybe up to like 3-4 years ago, because the only forms that were available were low dose or low concentration alcohol-based gels commercially available, that it was not that pleasant. But thankfully, on that area now there are compounded gels or compounded creams, water-based, that can be made into higher concentration. So the small amount of that will give the patients the testosterone level that they need. So either modern approach, which is transdermal, or more traditional approach, which is injectable, would be the options ahead of somebody who is diagnosed with low testosterone.
Well, thanks a lot, Pharmacist Mat, for that very comprehensive introduction to what we're going to be talking about here. One thing you didn't mention is I've had a number of doctors and professionals indicate to me that police officers and first responders and people working on shifts and stuff like that have a greater, basically a lower testosterone rate as they age. Is there any research or facts that you can share with us on that just before we move on?
I don't have access to any specific research done on police officers, for example, but we can look at applied science, right? So shift workers, people who are working in high stress environments, people who are following basically any schedule other than natural schedule of sleeping and waking up. What happens, of course, is their cortisol level is higher. That is established. And when cortisol is high, what can happen is cortisol has some direct and some indirect way of decreasing testosterone. So when cortisol goes higher, testosterone goes lower. Now, person to person, there would be different thresholds. So we can't generalize that to all police officers, all firefighters. But we can say that, hey, when you have a job that is more demanding on your body as well as on your psyche, probably you are in higher risk of some functions, all malfunctions in this case, of your body that turns off or brings down some of your hormonal functions. So not generalizing that, but it makes sense.
Well, thanks. And we're going to turn it over to Police Officer Mat, OPP Provincial Constable Mat Aris. Matt submitted many questions for us to discuss today, and I think it's just best to turn the floor over to Matt with this kind of foundation that Pharmacist Mat has set here to ask you some questions.
Yeah, I was just making some more notes here, but Matt had already touched on the cortisol levels and the correlation to testosterone. One of the things that, well, first of all, I'm not normally a fan of talking about personal health. I hold that very sacredly. But if this helps, even one person who listens to this, I'm happy to share it. But one of the things that I ran into initially was speaking with my general practitioner. Now, I don't want to sit here and bash and pretend that I'm any smarter or, know more, but general practitioners are just that. And it seems like many don't have any experience or knowledge in this, nor really should they. So one of the things I ran into is when I had initial blood testing with my general practitioner, I fell within the air quotes healthy range. And I was wondering if Matt could kind of touch base on that and provide any suggestions. Obviously, if you contact his company directly, I'm sure that can be mitigated, but just kind of explain the healthy range concept to people listening.
Yeah, Matt, you're touching on something that I personally I have seen a lot of dismissal just because of a number, right? So you go to the lab and and honestly, we are also guilty of that even in our platform. So the problem with measuring testosterone, or let's say the characteristics of existing lab tests, is a little bit problematic as we go forward. Let me explain this way. What we call quote-unquote normal in terms of testosterone is measured in a way that is not really affecting it's not factoring in your symptoms or your age. What you measure in a lab level is compared to 80% of all men across the board. Meaning that if my testosterone level comes back with a number, I'm just going to put a number there. The way we measure it in Canada is nanomole per liter. If come back with a number like 8.5 nanomole per liter, what lab does is it looks at the existing data of 80% of all men's population, and they say, okay, 80% of men are between 8.4 to 28.8. So you are normal. You're 8.5. All good. What they don't consider is what I just told you about how big a massive low testosterone level is in men's population. I already told you that 50% of men above 50 are dealing with low testosterone level. They are not functional in a way they should be. So the number, that 80% of all men, which consider a 90-year-old basically man and compare it with an 18-year-old, is not really something that you base diagnosis on. And that is part of what our doctors, our pharmacists, again, even including us, are looking at it because there is no other measurements really. What we should do is we put symptoms ahead of tests, meaning we should first ask, hey Matt, or hey our patient who is interested in this measurement, are you suffering from these 10 symptoms, for example? To what extent? How important is that for you? Then, if it matches the criteria that at least we suspect that maybe testosterone has something to do with this, then we measure, and when we see, okay, so the guy is lower, not lower than quote unquote normal, but lower, and suffering from this list of symptoms that all of them are directly related to low testosterone, at least for his body, this number of testosterone is not good enough. It's not quote unquote normal. But this is not, unfortunately, many of us in medical field think and trained. But good news is the perceptions are changing.
Well, thank you for that. I'm going to keep going with this discussion, Matt. So I have another question for you. And this is another loaded question. So maybe just sort of high level, if you could just touch on some of the risks that might be associated with TRT, and also, some lifestyle changes naturally that could help someone aside from TRT.
Let's talk about some risks associated with TRT. And I want to focus on real risks that, again, the way around it is, number one, making sure that we are only offering this to people who are suffering from low testosterone, and we are really helping real people, not people who are doing it for fun, basically. And second is constant monitoring of all of those risk factors. There are some, I would say, side effects of using testosterone that for some people might not be a big deal, for some people might be. So it's important to know. One important risk, or I would say possible byproduct of using testosterone or supplementing your testosterone, is fertility will go down, meaning that it is not a good option at all for people who are actively looking to have more kids to be on testosterone. Now, there are ways to mitigate that. There are medications to decrease the risk. But I always rather to be upfront with patients that, hey, if you are trying, or if you would like to have kids in near future, I suggest testosterone therapy is not for you. The sperm count will go down, We are not 100% sure if it recovers or not after or if you come out of testosterone. So that is one of the big real side effects of TRT. The second side effect that we try to basically early on capture and deal with is also one of the benefits of TRT, increasing red blood cells. So when you are low in testosterone, your blood cells go down, your red blood cells go down, and I talked about anemia, meaning lower blood cells. When you take testosterone, now the blood cells count goes up, which is great, and that is partially the reason that you feel more energized, you can exercise more, because blood cells are carriers of oxygen and nutrients all across your body. So this is all good. But it can also go higher than a certain threshold, and that can cause issues because your blood can become thicker than what it should be. And there are risks of basically heart conditions or stroke or any risk associated with having higher red blood cells than normal. This is one important basically parameters that are checked every 3 to 6 months to make sure you are on the acceptable level. And if not, basically we need to advise patients to go and donate blood. The Canadian Blood Services, they accept patients who are on testosterone, and that's actually a source of, it's a good thing to donate blood anyways, but that is something that is needed in those patients. So that is one real side effects that we try to measure for. Another side effects that is very important to keep an eye on or make sure we are in a safe zone is liver function. So testosterone in higher doses can affect liver function, and we need to make sure that we are measuring a few parameters through blood tests to make sure that liver is fine, it's functioning well, there is no problem there. If yes, are we adjusting dose? What are the other things that we do? And the last one I would mention is, just because it is part of the history of this field, prostate, basically, right or wrong, prostate health is attached to testosterone replacement therapy. So anyways, we keep an eye on your prostate health, because at very least, if it is affected and if the doctor doesn't catch it, basically everybody will come after that doctor saying, hey, like prostate was a big deal with testosterone, why didn't you catch it? So those are the main real risks around basically testosterone therapy.
The second part of that question is, naturally outside of TRT, what can someone do if they're concerned about their testosterone levels to help their situation out?
Yeah. So when we talk about natural way of increasing testosterone, number one, there are some supplements and there are some herbal remedies that are helpful in increasing the basically natural capacity of one's body to create more testosterone. They are working. I would say I would be amazed if I see that if you are symptomatic, it works for you. But if we are preventing lower testosterone, so if we are dealing with younger patients who are not really suffering from low testosterone now, but we want to prevent it, there are some supplements and herbal remedies very helpful. The other venue is thinking about all the things that brings testosterone down. We talked about the stress. We talked about cortisol level. We talked about having good general health, eating healthy. We talked about, I believe, good sleep, the right rhythm of sleep. All of these, testosterone is extremely connected to external factors. At very least, when we are younger, and I mean younger than 45, 50, we still have the capacity to rescue our own testosterone factory. And all of the general good health advice definitely will affect positively on that increasing capacity.
Thank you, Pharmacist Mat. This is the part of of our preparation here where we had a really long list of things that Police Officer Mat wanted to discuss. And we had a bit of a discussion about this list is really long. So I just want to turn it over to Mat, Police Officer Mat, and can you highlight some of the things that might not have been talked about so far that are of interest to you and your situation and what you would like others to know?
I think that Pharmacist Mat has covered a lot so far. One of the things I wanted to touch on that he had mentioned regarding supplements is there are a lot of supplements out there that you see on the market touting, to increase it. And I mean, have been involved in strength and conditioning and health for a long time. I was guilty of, being caught up in all of that. And I just wanted to mention that, if anyone is, they're quite expensive. And really, if you do the math, they're about on par with, treatment through whether it's a doctor I go through or Pharmacist Mat. They're not covered. And then it's not monitored. So how do you know they're working? And there's no clinical research. So just if anyone listening does kind of engage in that practice, it's probably advisable, at least at the very least, to maybe get your levels checked. One of the other things I wanted to ask Pharmacist Mat is if there's any correlation between low testosterone and mental health.
Yes. So cognitive function is one of the big role of testosterone in our body, again, men and women. And lower testosterone decreases the capacity of our body to tolerate basically stress, to be in a good mood. At the same time, the other way around, it's kind of like a vicious cycle. So when you are not in a good mood, when you are constantly under stress, your testosterone goes lower. Where your testosterone is low, you are more irritable, you are more prone to get to lower mood. One of the misdiagnoses that happens a lot with men over 45 is depression, meaning that just because the patient has low testosterone, the symptoms are easy enough for the practitioner, for the physician to be thought as depression. And it can lead to depression, of course, as you go forward, if it remains untreated. So there is a link, and there is a link from both sides between mental health and hormonal health in general, and in men, definitely the testosterone level.
Do you have any other questions, Police Officer Mat?
One other thing I wanted to ask is if I was going to just offer kind of a brief history of how I went about this. As I had mentioned at the start of the podcast, I've been training my whole life in strength and conditioning. That probably started at a fairly young age in the gym, around 14. Different types of training, competitions. And about 34, I was a little late to the game with being a dad. I had two young kids. By 37, training's always been a priority. And by 38, I'm noticing, my training is diminishing drastically. I can't explain it. Muscle loss, almost going backwards, starting to experience a lot of anxiety, unexplained weight gain. A colleague of mine that had been bothering me for a couple of years, actually, to at least get, and maybe Pharmacist Mat can touch on this, your baseline levels checked, if he is an advocate of that. I finally acquiesced and had my levels checked, and I had the testosterone levels of a 85-year-old man, I was told. So eventually we got on some treatment. Now, maybe another thing Matt can touch on is, for me, it took at least about 12 months to kind of really regulate and find that niche zone for my body. So one of the things, if anyone's considering, is to be patient. There's going to be some ups and downs. But I was just wanted to kind of explain my path to this, just in case anyone can relate to it. But one of the main things why I'd asked about the correlation between mental health and low testosterone is the fear of how many people go to their general practitioner and all well intended, one gets mistaken for the other, and it leads them down two completely different paths. And you also, just speaking with coworkers, you see the mental resiliency, especially in officers with 20, 25 years on, is not near where it could be. And for me, I refuse to accept age as a major factor. I didn't want to dismiss it. I think there was more to it. And, thankfully, a friend of mine encouraged me this way. And I feel like I'm 25 years old still. So
I want to touch on, if you guys let me, I'm going to touch on two things or 2 points that Matt mentioned that are more common that we might realize. One is the kids effect, I call it, meaning that this is very common, that when you have back-to-back kids, or think about it this way. This is the nature's way for us men to be indirectly in a situation that our testosterone level intentionally goes down. Makes our body and our mind a bit kinder towards kids. It's natural. It should happen. For the mom, it is completely directly related to all of the orchestra of hormonal changes in the mom's body. For dads, happen with a little bit of lag through different functions that are more like social functions than something that comes within. So any new dad, their testosterone level is slightly lower than before they have a kid. And that's absolutely understandable. And it should bounce back. When we have back-to-back, meaning like close enough kids together, like after two years, you might have another one. I don't know Matt's situation, but generally I'm talking. Plus the trauma that happens with kids, positive trauma, but not being able to sleep well, a lot of stress, feeling of more responsibility, feeling of change in your life, the perception change. All of this is sometimes, along with that natural decrease of testosterone, that is kind of the last straw that passes you through that threshold of not returning to your testosterone level. This is what I found very common, that around the age of 40, 38 to 45, 46, this is what happens for most of people who have like kids at that point. A lot of basically responsibility changes. Around that is the time of somebody's career that they need to focus more on work. It is hard on the body, and sometimes the manifestation of that is bringing down testosterone level sooner than basically otherwise that man would have experienced, if that makes sense. So that is one thing I want to contribute to Matt's story that is very, very common. The other thing that I love Matt sharing about his basically treatment journey is the very important fact that it is a journey. I wish there was like a magic pill that all of us could have taken and all is fixed. It is a journey. It becomes better and worse and better and worse. There is a basically back and forth between the body and the medication. And that is why more important than honestly the treatment itself is the follow-up, constant supervision, constant lab tests, constant changes of medication, dosing, forms, until you get to the point that you are stable. And even after that, constantly checking, because now you are trying to avoid side effects. You're trying to, again, keep up with the changes of your body that wouldn't stop at this point, Matt. So, Matt, you are not out of the weed yet. It's still going. Your body is going through changes. And 3 years from now, things are different from today. And constantly looking back will help you keep yourself optimized for a long run, if that makes sense.
I think it's great information both of you have providing for us today. And thanks for all the context. Thanks for sharing your journey, Matt. I don't want you to feel like you're all alone here. I've got a question here as well for the Pharmacist Mat, and that's basically somebody listening to this podcast that's got low energy, is kind of down all the time, been a police officer all their life. Who do you call? What do you do? Type thing. And I'll give you a little bit of context why I'm asking that is that's how I was feeling after 30 years of police work. And my doctor gave me the testosterone pills, and that didn't work. And like my level was actually in the lowest 3% of the population, like in the toilet. And just trying to put it in layman's terms. And eventually I found this Dr. Lawrence Comer in Burlington, Ontario, and he tested me, and he just said, "Dear, take these injections and I'll monitor you." And it's as simple as that. And you know, the medication is covered by benefits, and the only thing that you pay for out of your pocket are the needles. And it's the best thing I ever did. I'm not a doctor. I'm just a retired cop. And I just think it's so important that we're having this discussion. So, given that and what Matt's saying, and there'll be a lot of other police officers probably listening to this, not necessarily up guys, Matt, Pharmacist Matt, but like, what's the call and what do you say? Who do you call and what do you say?
I would say this step one is you noticing the symptoms. So especially when you are above 40 and the symptoms that we talked about, low energy, reduced sex drive, that brain fog, all of those basically symptoms that we talked about a lot. If you see those symptoms in yourself, that's the sign that, hey, you may be low in testosterone. I would say step two is there is a questionnaire online available. You can just Google it. It's coming out of one of the research. The name of the questionnaire is ADAM questionnaire, like the name Adam. It's androgen deficiency in aging male. So it's an acronym, but it's ADAM questionnaire. That just basically rates you in terms of, hey, like, are you making this up, or no, actually you may be low in testosterone. Then next step is just going to your doctor. And I would basically bring that ADAM questionnaire answers with me and say, hey, like, maybe, like, what do you think? Do you think that given my age, given my symptoms, is this beneficial for you to authorize a lab requisition for me? Let's go and do the test. This is the part that I've seen some doctors have basically some level of rejection, and I don't understand it. I think this is a common sense that in this age we need to do some tests, and hopefully the result is we are all good, right? So then basically you do the test, and you would know the number first. The doctor would know the number. You have the symptoms. And if you are in the lower end, if the doctor tells you that, hey, what they told you, Scott, for example, hey, it's low, then either they are the ones who can help you, or they can refer you to somebody who might be helpful of taking care of you for testosterone therapy, if that's the case. Step one is always, do you have the symptoms? Step two, measuring it using that Adam questionnaire, for example, or just having the symptoms should be enough for your doctor. Then testing, and then we are talking. Then basically if this is the case at all for you or not. If not, awesome, do the test again 5 years from now. If yes, okay, perfect. So what should we do for that? And I'm sure that basically there are enough of knowledgeable doctors out there who can help you find the right treatment for yourself, try it out, see if this is good for you or not, and remeasure it, and then you will have a solution.
Well, thank you for that, Pharmacist Mat. I really appreciate that. We're gonna kick it over to Officer Mat, and I know he has a few names that he wanted to mention about, where people can get further information. So, can you elaborate on that?
Yeah, most of the names I'm going to mention are probably very well known, but some of the people I follow, Dr. Peter Attia, he's got some really good information on just training for longevity and overall wellness. Dr. Andrew Huberman, it seems to be a wealth of knowledge, very accredited individual who does a lot of deep dives. Dr. Matt Walker, he's been featured. Most of these people have been featured on the Joe Rogan podcast. Both very highly tenured and intelligent people. Dr. Matt Walker talks about a lot of sleep hygiene, which I try to focus on as well. One of the things that I just wanted to mention to continue with what Pharmacist Mat was saying is just the importance of advocating for oneself, especially it seems in our healthcare system, because it's so overwhelmed. It's just to not only advocate for yourself and basically refuse to take no for an answer, but also just to take charge of your own health. If don't just go to Pharmacist Mat and get prescribed TRT and take it and that's it. Really become engaged with your treatment and educate yourself and ask questions and why is this and what does this do? Don't go into any kind of treatment blindly. So that's pretty much all I have.
Well, thanks a lot, Officer Mat. We're near the end of our episode here, and I was just wondering if you had any final words.
My final word is basically what actually Officer Mat said, that just be advocate, try to look forward for your health and try to be advocate of your health. Guys, we are not a big fan of going to the doctor, and we only go there when major things happen with a lot of delay. But if you are feeling run down, if you are basically feeling that you're losing something, you don't need to wait for that big event to happen. Just be educated in how your body basically reacts to different things. All of the resources that Police Officer Mat mentioned, I do respect all of those guys, all of those names. And good news is there are lots of information now out there. So just be advocate of your health, move forward, and it will make a big difference for you.
Now, Pharmacist Mat, I want to, just before we let you off the hook, I have one question, being the woman talking here. I was just curious how testosterone levels affect women without, opening a huge can of worm here, but it's been on my mind.
It's interesting. Yes. So exactly the same roles that testosterone have in men's body, it has in women's body as well. The only difference, the big difference is the total level of testosterone naturally in women is way less. We are talking about less than 10% of men's basically concentration of testosterone in their blood. But all of those energy, sexual desire, bone health, muscle health, all of those functions are happening in women's body as well. As women age, especially after menopause, testosterone levels naturally drop. And that is why that now for some of the HRT basically protocols, some practitioners are looking into adding testosterone therapy to women's side as well. It is not as well known and practiced as men, but I know of at least a few practitioners that made it basically their main protocol to not only give women after menopause hormones like progesterone and estrogen, but also include a little bit of testosterone in the mix. Especially, I would say the red blood cell reduction is a big problem in women. It's not a huge problem in men. So that plus energy and libido would be something that some practitioners try to maximize by testosterone therapy in women.
Very good. Thank you for that information. I mean, this is a huge topic. I'm sure we could have spent another couple hours talking about it, but I wanted to thank you both for joining us today. This discussion has been extremely interesting, and we just want to thank you for your time and for joining us today.
Thank you.
And we want to thank you, our listeners. If you like what you hear, please hit the subscribe button on the podcast platform of your choice so you never miss an episode. New episodes are released each month. If you have any questions or have ideas for future episodes, please email us at communications@oppa.ca. Until next time, thanks for listening and stay safe.